Hello, good evening. This is Dr. Khieu again, and seems like only a few weeks ago we're talking about COVID Part 2. But now we're going to switch here and talk about women's health, which, as many of you know, is my specialty and take care of a lot of women over the years. And although I'm reminded constantly, I'm not a woman, what do I know? I'm not never pregnant, what do I know? Certainly take care of a lot of patients, many thousands of patients, and I have a good feel to that. So as you know, the topic of women's health is very large, and the question is, what do I talk about? And I think it really boils down to just a few items. Number one is just kind of reproductive health, and then number two is general health, physical health, and the number three is stress with the big capital STRESS. The reason why is because over the years the female and the woman become the mom, become the grandmother, become the caretaker of the family, the children, the grandchildren. And besides the fact that she takes care of herself, but then she over time takes care of much more. The family, and then as far as the family growing up, then she take care of someone else's family and the children family. The problem is then one day she wakes up and she look back and she realizes that she's not taking care of herself, and that's the biggest problem. So what I would like to do is let's address the elephant in the room, and number one thing, which is the problem for both men and women in America, is I'm going to show the first slides right here. Is the big old pandemic that we've been facing for many years, not the COVID pandemic, the obesity pandemic. 50+% of us are actually considered to be obese, or at least have a large extra amount of excess fat. And as you can see on the screen right here, it is the cause of a lot of problem. So because you have the extra excess fat, you actually can have a lot of liver problem. The liver got congested. You probably hear about the non-alcoholic liver disease. Did you know that the number two liver problem in America is this non-alcoholic liver disease, and mostly affected women because a lot of the ladies actually don't drink a lot of alcohol, so they don't have the alcoholic liver disease, but then the fat over time accumulated. This becomes a big problem because over the years they accumulate more fat, and that actually store into their liver, and then eventually the liver runs out of room, and then that actually backed off into the pancreas. Literally today I have a patient that literally having an extra 10 centimeter of extra fat in her liver. Well, the liver is about 15 centimeters, so 10 centimeters make it 26 centimeters. Just imagine more than 50% of her liver is loaded with fat. But then eventually they actually got clogged up, and it pushes over to the pancreas, and that becomes another problem. Because why? The pancreas produce a lot of stress hormone. Stress hormone has this good feedback loop so that we can control ourselves well. But when it's all clogged up with a whole bunch of fat in there, then our feedback loop is not as effective. Well, what else is produced in the pancreas is actually insulin. So then all of a sudden our ability to control insulin is, or glucose, is going to be a lot less effective, and eventually you become pre-diabetic, and then eventually you're going to become diabetic. And then of course there's a whole bunch of other issues and problems. People could have menstrual cycle irregularity, dysmenorrhea, endometriosis, adenomyosis, interstitial cystitis, and then of course they can have all the other kind of problem with skin related problems, psoriasis, arthritis, and then blood related problem. You hear about phlebitis, you talk about having cardiovascular problem where you can increase the risk for ischemic heart disease and stroke and alike. Pulmonary system also have a problem. Now, the reason why all of this is important to talk about is because our medical system is designed that each one of the specialists do what? Focus on their own organ system. And therefore, a lot of these specialists are very reluctant to deal with another organ system. For example, you go to see your cardiologist, he or she would be more than glad to deal everything from the cardiovascular system. But then all of a sudden you you have this little skin problem, you have a little menstrual irregularity, or maybe pain with your menstrual cycle, go and see Dr. So-and-so. That becomes a problem because, as you can see in this picture, everything is related in the same body, the same system. After all, there's one of you. And the biggest problem that affected the whole system that we mentioned is the stress hormone. So when you have too much stress hormone around, then that affects everything else in a much higher fashion. So I'm going to show you the second slide, because when you have a lot of stress hormone, that a lot of them come out from your pancreas. In slide number 2, you can see on the slide the typical stress hormone is cortisol. So you hear about cortisol increase your sugar. What does that do? Well, that increases sugar, increases fuel of life. I look at a lot of organ system and all the condition that I mentioned to you earlier, they all have the ITIS, at the end. All of that is just a medical lingo to say that you have a lot of inflammation. You have inflammation in your blood vessels, so phlebitis. You have inflammation in your joint, arthritis. You can have inflammation in your bladder, interstitial cystitis. You can have inflammation in your female's organ system, endometriosis. So the list goes on. The problem is these are fuel to the fire. So when you have a little fire being the little inflammation and you have extra fuel supply around, pour right into that, that's going to burn a lot stronger, much more inflammation. So if the treatment is only to put out the fire at that point in time, although it is effective, but it's not going to take out the cause of the problem because the underlying issue is still there. The second part from a female standpoint that is significantly affected is that you can see the similarity between your cortisol molecules and the estrogen molecules. So as you can see, they are very, very similar, almost identical. So as a result of that, as you have an increased amount of cortisol level, and I think a lot of the lady has no short supplies of that. You have a lot of stressor going on with your life, and then you secrete much more cortisol level, and a lot of that work and feel similar to estrogen, especially estrone. So then all of that extra estrogen effects now affects your female reproductive organs, and that's why you hear about people that have these kind of menstrual irregularity. You hear about people that have polycystic ovarian syndrome. Those are just typical examples that you had too much hormone around. Your body is no longer synchronized to have that menstrual cycle, and as a result of that, now you get too many hormones and your body get thoroughly confused. You don't even have a once a month ovulation anymore. You got multiple attempts to ovulate, but then everything is not synchronized, so therefore there's no orders in your system. And that also can cause a lot of other side effects. Of course, too much of these estrogen-like hormone overly stimulate the lining uterus. Your uterus now getting really thick, and then as a result of that, either you have irregular bleeding or you can have heavy bleeding because when it's so thick, when it's time to come down, instead of having a regular amount coming down, you get excessive amount. And that's why sometimes you hear women that have, wow, I have a whole bunch of big clot. The clot basically tell me how thick the lining of the uterus is. So if some ladies say, well, I have this clot, okay, this is a lot, but someone got a golf ball size clot, that's a lot more. And all of that clot basically blood that didn't come out fast enough, they're sitting around inside the uterus for a while, and then eventually form the clot. The clot becomes an irritant, so ladies actually had baby before, it's going to tell, yeah, I got a terrible cramp that feel just like having a baby, contraction cramp, and exactly just that. Your uterus feel irritated, big old contraction, push out the clot, and that's how you hear little chunk coming out. So that's the result of what exactly happened with the extra amount of cortisol, extra amount of estrogen, overly stimulate your system, and that becomes a problem. So then the question, what do we do about it? All of this kind of turn back to how to have a healthier body. But as you can see, even if you do everything perfectly, and those of you who listen or look at my other posting about having a healthy body, you already hear about this, and I mean, it sounds like a broken record, you know, the 3 simple steps to do. At the risk of boring you, I'm going to just say it over again, because I think the more I mention it, the more I think it kind of sink in for a lot of you. So normally you don't have a lot of issues and problems in your life, you're doing well, you don't have to do anything super strict with your diet routine. But whenever you have a flares up, the last thing you want to do is make it actually worse. So then just go to that simple 3-step process that I mentioned, maybe for a week to 2 weeks, or even 3 weeks or so, in order to bring down the amount of fuel of life. Therefore, it's going to help to reduce the amount of inflammation. So those are just a simple thing we mentioned before. Water, black coffee, tea to drink only. Don't drink anything else is for those 3 weeks. Again, I'm not telling you to do this forever, but I think that will help to slow things down and sort of give your body a chance to catch up. So that means there's no creamer, no sugar, no alcohol, no juice, no milk, no soda, obviously. Number 2 is finish eating by 7-8 p.m. Don't eat until 7-8 in the morning, because then all of a sudden that become a problem, because then your liver constantly has to go to work. So every single day you give your liver an extra 12 hours to rest up and to catch up. The analogy I use is like, it's like, you know, you go to work and your boss gives you a whole bunch of tasks to do, and then the next day your boss gives you more tasks to do, so you fall further and further behind. Well, how do you catch up? Really simple. You have a day that you don't have any extra tasks. You focus on catching up all of that to-do list, and then you'll be caught up. But if you constantly running around doing stuff, you never catch up. So that's what you do with your liver. Give your liver more time to catch up, and so then it can serve you well. And then in the morning, have a light breakfast. So therefore, again, give your liver a break a little bit. 1 or 2 eggs, avocado, cucumber, something green, something protein, and that will help to not put an extra load. And you know, a lot of times people ask the question, well, can I just do some oatmeal in the morning? Well, oatmeal, I think, is wonderful. It's complex carbohydrate. In a regular person, no big deal. But if you're trying to reduce inflammation, reduce the flares up, and then you want to do oatmeal later in the day, like between noontime and 7 p.m., and I think that would be a lot less of a extra load onto your system. And then finally, for that duration, no fruit. Fruit has a lot of extra carbohydrate in there in the form of fructose. Fructose cannot be used for the rest of your body, so if you ingest it, it has to go to your liver for processing before it actually get turned around and delivered to the rest of the body. So when you actually have those extra fructose around, your liver has to immediately go to work, and that becomes a problem. So just take a break on the fruit business for 2-3 weeks that we talked about, and that helps to reduces the inflammation in your system. So the question is, how often you do that? Well, the best doctor in the house is actually you. You pay attention when you have these little flares up, whether you have interstitial cystitis, arthritis, endometriosis, and menstrual cramp, muscle pain, all of that stuff, even brain fog. Just be strict for a few days, and I think that will be significantly helpful for you. So once you do that, then you're going to be able to manage yourself a lot better. But even if you do everything perfectly right, 30% of the time, you're not going to get better. Why? Because I think a lot of you, because of who you are, being a woman, being a caretaker, being a mom, being a grandmother, being the pillar of your family, carries so much stress in your life that your stress hormone constantly revving up, go through the roof. You have so much a sympathetic system firing all the time, and the fat actually congested your pancreas even more, so now you fire even more stress hormone. You just never really stop, and that becomes a problem because you get overloaded with cortisol level and overloaded with sugar or carbohydrate floating around, and then all of a sudden you just never recover. So my recommendation for a lot of folks is that instead of doing something right now, I think it is really important for you to take a step backward, reevaluate your life. Where are you right now? What is it that you want to achieve? Where do you want to go? Plan it out. And once you plan it out, you have a concrete plan in place, then I think your life become a lot more under control, and then it seems to be spinning out of control all the time. And I think the biggest problem a lot of folks I deal with that have is that because of the way society is, there's certain kind of expectation, right? So if you have a little kid, they have to join these team. They have to do cheerleading, they have to do sport, they have to do football, whatever. And then next thing you know, you're constantly running all the time. Well, it is nice to do a lot of these activities, but what's really important is to learn the values of life, the values of hard work, and have that in the process, but don't make that as the stressor in your family. And I think that's really important to kind of have a balance of that and define. Instead of trying so many things, maybe try one or two things, or 1 year try this one, another year try another one, but don't do it so much that it actually consumes you. And I think that's the important thing. The analogy I use is like, if you in a boat in the ocean and a whole bunch of other family members also in their own little boats, and there's a whole bunch of shark in the infested water, the last thing you want to do is jump into the water and try to save everybody, because chances are you got eaten by the shark and then you can't save anybody. So your job right now is, again, take a step backward, find a way to rejuvenate yourself, get your body strong and healthy, physically fit, mentally fit, and spiritually fit. So then that way, then you can be a much stronger person, so that you can take care of the rest of, other life obligations or business or people that you need to take care of. Now, there's going to be time that a lot of the folks that I come across just feel like they're the only person that could save the world. They're the only person that can take care of mom or dad or brothers and sisters or children. That's not true. The only reason why you feel like you're the only person is because you're the one that volunteer, and everyone else is in the family starting to kind of take a step backwards. Like, well, guess what? I don't need to do anything because, so-and-so is take care of it. So the thing is, asking for help is not a sign of weakness. So if you ask for help from your husband, your children, your brothers and sisters, and take care of mom and dad, that kind of thing, is absolutely not a sign of weakness. So therefore, you don't feel like you have to do that, but plan it out, because in that way, then it's going to be a lot more quantifiable. It's like a bucket of water. If you have it so full already and you're trying to put more and more stuff on there, eventually it's going to spill over, and then you won't be able to feel accomplished. So it's much better to kind of line up the load a little bit, divide things up, and then go from there, but have it in a more orderly fashion. So write it down. So how do you know what to do? Really simple. You write down the kind of list. Those are the important things that you need or you want to take care of, and there's less important item you need to take care of, and then you basically delegate to some other people in the family. Now the only trick is that you need to be able to live with imperfection. So you can't just say, well, nobody can do as good as I do, so therefore I have to do it. Well, life is imperfect, so therefore if you try to do it yourself, every single thing, you're not going to have enough time in the day. So you need to use a teamwork approach in order to do that. And sometimes teamwork approach might not be as perfect as you like it to be, but that by itself is going to be a good exercise. So for example, I have a young lady that have 10, 12 years old kid in the family, and she's constantly running around doing everything. I said, well, how come you don't have the 10, 12 years old kid help with the cleaning in the house, maybe a little cooking, maybe clean out the trash, at least clean out their room, instead of asking mom to do that all the time. Number one is going to be teaching them to be self-sufficient, and then number two is to lighten up the load for her, so then she doesn't have to constantly doing like 10 things at the same time. And that by itself, I think, is a significant improvement already. And then finally, I think it's important for you to rejuvenate yourself. You need to always ask yourself the question, what is it that makes you excited? What kind of activity that you do that you feel rejuvenated, you feel alive, you feel great, instead of just taking care of, people or business or tasks that you need to do. Some people could be, volunteering at a certain kind of, SPCA, for example, or a singing group, or volunteer at, a homeless shelter. But the point is that you want to be focused about what is it that you need to do. And I think everything else is going to follow. So for example, I have a patient that's been doing really well with her stress management and pain control and that kind of thing. So I asked her that question. She said, well, I always like to hold baby. I love to hold baby. I said, well, that's great. Well, look at some NICU or nursery and volunteer and do there. And guess what? She was thinking about doing that and getting ready to go. But then she didn't have to because life has an amazing way to sort itself out. So she has a niece who actually by herself happened to get pregnant, lonely, had a baby, and now no one take care of the baby. Well, guess what? This patient all of a sudden become the only one to help with this woman to have a baby. It just happened to be. And she now help with the baby. She's happy to be able to help with the lady that has a newborn baby. And she's happy because she had that sense of contentment holding on that baby. So the point is that you need to have a clear goal in mind, then you work toward that goals. And sometime when things present itself, you need to be ready to hang on to that opportunity. So like for this lady right here, the opportunity just kind of come up out of nowhere. She certainly didn't expect that, but I think that's the important thing. So stress management become the biggest thing, because if you don't manage the stress well, next thing you know, you're going to actually start to accumulate more weight and then more cortisol and then more stress hormone, and everything starting to spiral out of control. And I think that's really, really the important things to do. And once you do that, then all of a sudden life become more livable, life become more exciting, because you have something to look forward to. You do things that are rejuvenating for your body. And I think that's really the important thing. And then from there, just have a routine. Having a routine in life, I think, is really important, because then you always have something to fall back on. So then that way you constantly, if you things start spinning out of control, you go back to that routine. That doesn't mean that you have to do that routine all the time, but you know what to do when you're back to routine. So for example, I have a patient, diabetic, did really well with me for a while. She disappeared for about 6-7 months or so, come back, show up out of nowhere with sugar like in 300-400 ranges, and everyone got excited about her, and I was too. I said, well, guess what, just let's get back to basic. Well, do you remember all the diet routine and all that stuff, and clean out your liver and all that stuff? She said, sure. So guess what? I made her appointment once a week for the next 3 weeks so that we can bring the sugar down, check her sugar and stuff. She came back one short week, and the sugar by fasting is about 100 and under, and the 1 hour is running about 130, 140, if 150 highest. Absolutely amazing in a short amount of time. So then all of a sudden, instead of seeing her the following week, she already got this going really well and mastered that art because of her preparation. She basically, I just skipped the next visit following 2 weeks and see how it goes. So again, once you actually learn the technique and learn the art of this, a lot of time you can go back to the basic and be able to improve yourself in a much shorter amount of time. But the trick is preparation. Do the training, do all this stuff when your body might not need it the most, because once you actually got to that point, got to the point that you really need some help, you're already there. And I think that's really the important thing. And then I think that would be extremely helpful. Then the next part, the question is, childbearing, having a baby and things like that. Whatever happened, whether childbearing or other kind of event in your life, your job is, and I tell a lot of my postpartum patients the same, whatever the weight that you gain during pregnancy, try all you can to lose all of that extra weight afterward. Because why? All the weight that you gain during pregnancy is brand new, like only 9 months you gain the weight. So to lose all of that back, whether it's breastfeeding, whether it's healthy diet, whether exercise, no matter how you do it, just get back to your baseline. Because once you get your baseline, it's going to be nice and simple. These are new weight that will be put on, so therefore it's much easier to pull it off. The weight that is much harder to pull off are the weights that sit around for 5 years, 10 years, 20 years, but weight that are on only for 9 months or less, a lot easier. So always focus on that. And of course, if they have difficulty to lose the last 3 pound, 5 pound, 10 pound, whatever the weight is, then come and work with us, and then we'll get you to that level a lot sooner. The most important thing is make sure you don't have the complacency, because the complacency and not checking your weight, next thing you know, you'll be about 10 pounds behind, and then 20, and then 30, and then eventually you feel that it's an impossibility to turn around. But you know something? It's never impossible. So therefore, it's never too late. And I think it's really important to focus on that. Lastly, I think it's really important to kind of remember, you hear the phrase treat your body like a temple. So what does that mean? Well, all of us are born like having a shining temple. The problem is we put trash and graffiti and abuse it and, kind of not keep up and keep it nice and clean and in amazing shape. No wonder it's struggling all the time. So when you found your body is not shining like a temple, all you have to do is clean out the graffiti, clean out the trash, don't put extra trash in there, make sure it's nice and neat and in orders. Then all of a sudden, the shining part of that temple is going to come out all over again. So I think that's really the important thing is it's never too late and very important to just kind of, step backward, prepare it, and take good care of yourself. Then that amazing body of yours is going to be able to shine and be healthy again. And I think that would be the most important lesson to learn from today's talk, and that you can stay focused and get better. At some point, we're going to have some of the questions. So anybody have any extra questions, please pose it, and then we can just have some question and answer, because obviously the topic is so large. Me sit around talking all day long is going to be helpful. Then answer directly questions for you.
Do you want to talk about delivering COVID too?
At the end. So in the meantime, while people getting the questions ready, let me tell you another question that I think a lot of people ask, and I think it's extremely important. Sometimes you're in a certain relationship, and it's not a cool relationship. Prince Charming, everything is going well. And then 3 months, 6 months, a year, 2 years later, Prince Charming turned into like a monster. I was like, why is it that? He's like, everything was so cool. All of a sudden, the relationship go downhill. And then all of a sudden, a few years later, you go through another cycle with another rerun. Another Prince Charming come around and another disaster happen. You ask yourself, why is that? And the answer is that is because of what happened to you when you're little. So when you're little, whatever the event that happened in your life, in your family, there's some kind of routine, some kind of situation, family. It could be, people yelling at each other. It could be some kind of dysfunctional family. But the thing is, when you're little, you can't even remember that. But your subconscious mind already have those kind of pre-programmed in there. So then, of course, when you grow up, so I don't want to be, something bad like alcoholic or abuse or anything like that. And you're pretty conscious about that. Except you were in the other environment before. So then all of a sudden now you meet somebody down the street, and that person have a similar kind of growing up livelihood. So then it feels very comfortable. So you hang with a person, they understand exactly what you're talking about. It's like wearing an old shoes, like you feel totally comfortable in that. The only problem is that when your partner is completely in his conscious mind, he's very articulated, loving, and caring, all the stuff. But then when stress happens, relationship occur, other kind of family situation occur, children occur, financial stress occur, other kind of stress occur, work stress occur. Then all of a sudden, the stress turn him into the similar situation as he was when he grew up, and then all of a sudden now become a major conflict, because then you have those kind of similar family dynamic. So it's very important to be cognizant of that. So if this didn't happen to you, of course, nothing to worry about. But if you see these recurrent themes of, relationship, that kind of thing, definitely important to kind of discuss about it. The first rule for any kind of these kind of stress-related situation is to be cognizant. Be cognizant that it is a factor in your life. Be cognizant that it is happening, so that you can do something about that. Because if you are not cognizant about what's happening to you, then it's almost an impossible task to do anything. So that's why it's really important to understand that. So just be aware of those kind of situations. The second thing I highly recommend is, you ever watch the Disney movie, Frozen? Just learn that song, Let It Go, Let It Go, Let It Go, right? Obviously, I'm out of tune, I don't know how to sing well, but the point is, sing that tune in your head. So whenever things happen to you, when it's a bad day, things are not going well, issues and problems, then just learn to sing that tune and let it go. Don't try so hard. I think sometimes we try so hard, we try to do so many things. Next thing we know, it's just not happening and becomes a problem. So let me show you the third slide right here. So the next thing is that you remember last time we talked about COVID. How's it related to all of this thing with women's and women's health and that kind of thing? Well, the same problem you see right here. When you have all of the COVID coming in, you get terrible inflammation going on in your pulmonary system, in your liver, in the rest of your circulation. They all clog up the liver, and when it clog up the liver, next thing you know, you get a lot of other issues and problem going on. Your body's unable to clear everything out, and then you become much more congested, and then your system slowly is going to shut down. So that's why we talk about the artichoke tea, to flush or clean out the liver, so then that will make room for the new batch of inflammatory tissue that your lymphatic drainage is going to drain right into your liver, so then you're constantly cleansing your body out. So that just kind of review of what we talked about last time, but this kind of illustrate that it's all tied together with the same issues and problem. There's really no difference in the first slide that I show you with obesity and how it affects all these different organs. The coronavirus is just a much faster scenario, affects your system a lot more focus on a certain organ. And just you see in the slide, you see where do they go to? A lot of these actually dump into your GI system. So I think that is one thing that people don't talk about a lot, is that after you get coronavirus and you get the coughing and all that stuff, the place a lot of the coronavirus is going to be hiding is going to be in your gut. So therefore, it's very important for you. If you haven't cleared out, tested negative in your COVID after 2 weeks or 3 weeks, that'd be extremely important to do some sort of GI cleansing to flush, clean out the colon, in order to not having these extra virus kind of hang in there and still regrouping themselves, because the problem is that they can regroup themselves and then they can kind of reinfect you. So that's why it's really important to do that. But that's just a little side note. Alrighty, so any questions here? We're going to just entertain that.
What are some ways we can start to decrease cortisol levels?
So the best way to decrease cortisol level is what? Secreted by the sympathetic system, fight or flight response. So guess what you want to do? You want to kick in the parasympathetic system. So that's what we talk about, what the stuff that you enjoy doing. I think the problem is a lot of us too busy doing stuff. Even when you take a walk, many of us don't even have time to ourselves. We try to listen to self-help book, some sort of podcast, or we talk to friends, something like that. I highly recommend people to have time to yourself so that you can be in touch with nature. So then that way, then you'll be able to feel and rewind and discharge. I mentioned about grounding technique. That is one of those ways. But there's other ways that you can also do things that you really enjoy thoroughly. The stuff that you enjoy doing, be proud of what you do, even though no one pay you a single dime. If they pay, it's nice too, but the point is that do that, because then all of a sudden that will rejuvenate you, and that will give you that sense of accomplishment, the sense of blissfulness. Because at the end of the day, I think all of us wanted the same thing in life. What is it? Blissfulness. What is blissfulness? A sense of contentment, no kind of conflict. There's no, people use the word happiness, but it's in many ways not true. It's the blissfulness that we're looking for, that sense of serenity, right? So in order to get to that point where you have parasympathetic going, you do the kind of stuff that you enjoy doing and love to do, and need to factor it in as a part of your life, because if you don't, next thing you know, your body constantly go back to fight or flight response, and then no wonder you constantly pumping out a boatload of cortisol level.
How important is it to get a pap smear or pelvic exam when you turn 21?
Actually, it's not so important. I think that sometimes people say, oh, well, it's really important to do that. What is about 21 that is, that requires you to do that? Why is it not 18, 19, 21, 20, 23? It's an arbitrary number that people put there. It's actually not the 21. It's the function of when you first have relationship. So if a young lady have a relationship at 13, then it's important about 16, 17 to get something checked, because you want to be sure there's no growth or anything like that. Why is it important? The progression of the HPV virus, which is the main virus that actually causes abnormal pap smear, is that it go from normal right here, inflammation on the abnormal pap smear, and the cancer over there. It took about 5 to 10 years to go from completely normal to abnormal. So in the span of 5 to 10 years, that can turn into something bad. So for example, if you have sex at 13, I'm not saying that people should, but if they do, then about 17, 18, about 4 or 5 years later, or 3 even better, to check. So you want to be sure there's nothing already going that direction. So that is, I think, more important than just an artificial number. So if you have a relationship at the age of 21, so technically speaking, if you have PAP at the age of 23, 24, totally reasonable. Again, the best doctor in the house is you yourself, so pay attention. So if you have regular period, no cramping, no other symptom, then you would be fine. However, if you have irregular bleeding, especially bleeding after relationship, or a lot of cramping, that'd be good to kind of check it out to see what's going on. So that's how you do that. The second question I think a lot of people ask about is, what about all these immunization, the Gardasil for the HPV, is it worth it? Well, it is worth it in the sense that it's going to help to reduce a lot of these HPV vaccine. But just like the discussion we have with coronavirus, it's really important to protect yourself as well. So if you have multiple partners, you have a lot of different exposure with a lot of different strains of viruses, then chances are the vaccine is effective, but it's not going to be a foolproof. So I think that's really the important thing. So whether you do or you don't get the Gardasil vaccine, I think it's really important to be careful. And the simplest thing to do is just standard condoms, because that have the barrier, so it reduces back and forth transmission of these viruses.
What is the best way for women to balance hormones as they age?
The way to balance hormone, you see that first slide that I show with obesity and all the extra cortisol level and all of that gets secreted. Best thing to do, not gaining weight. I think that's the biggest problem. Sometimes because you're too busy taking care of people, taking care of family, taking care of kids, you forgot to take care of yourself, and then the weight starting to catch on. You look back, you're already 30 pounds over, or 20 pounds over, or 20 pounds over, and that becomes a problem because that extra fat now become a factory to churn out more steroid in the form of cortisol or other kind of steroid that look and feel and act very similar to cortisol or similar to estrogen. And that becomes a problem. So once you're actually not gaining the weight, I think that is the most important part of the battle. And then number 2 is reduce your stress, because when you actually reduce the amount of cortisol, that also reduces the amount of stress. So it's all about make sure you have less production of extra steroid and cortisol around, because all of that is going to balance it out. Your body is already naturally very balanced. You just don't want to have too much of the production of these bad steroid or hormone, because that is what actually get you spin out of control. But it's a one of these kind of feedback where when you get worse, then you get much worse and keep going. You keep going downhill. And so the point is to have ways to stop the process and reverse the process. And I think that's is really important focus to do.
Do you have any advice for women going through menopause and getting hot flashes?
Yeah, so before we talk about the hot flashes, you ask yourself the question. I think a lot of the patients don't ask the doctors enough, why are you having hot flashes, right? What is hot flashes? Hot flashes is the fact that your blood vessel now doesn't have the regular supply to estrogen anymore. And then there's extra inflammation in your blood vessels, so the flow from your circulation is kind of fast and slow and fast and slow. So it's not as nice and smooth anymore. That is the main problem. So if they start to go up here, then you start to have these kind of weird headache and mood changes. And go to your skin, you got these kind of weird hot flashes. You feel like you're burning up. And then go to the entire body, then you feel like you just like profuse sweating, especially in the middle of the night. You take all the clothes off and you still feel hot. Those are the kind of thing. So the way to take care of it are twofold. Number one is how to kind of give you a little bit of natural kind of estrogen because now your estrogen level is lower. So instead of taking all these extra estrogen pill, which has a lot of other side effects and can be dangerous for you, just have some of the healthy natural estrogen, and one of those typical phytoestrogen come from like soy product and that kind of thing. So the simplest thing to do, get one of these unsweetened soy milk, and then you can drink that. That's nice and easy, and I'll take care of that. The other thing, my favorite, is that take something to relaxes your blood vessels a little bit, because that will help to make the blood flow easier. So one of the product is called L-arginine. It's one of these amino acid. By the powder form, not the pill form, because it's easily absorbed into your system. And then all of a sudden now you take it for about 3 to 4 weeks. It's going to be nice, relaxed, because it helps to increase the amount of nitrous oxide in your body. And nitrous oxide is a nice vasodilator, relaxes your blood vessels, so the blood flow is easier. And then all of a sudden you do better. But at the same time, you don't want to put more fuel in the fire. So if the fire is the inflammation along the blood vessel, so the thing that actually put more fuel in the fire is carbohydrate. So extra carbohydrate around, like fruit and like carb and all the stuff, is going to actually make it worse. So if you get these flares of hot flashes, guess what you do? Just go easy on that for a week or so. So I'm not telling you to do forever, but that will help to bring the situation down to a more controlled level. And I think that's really the important thing.
Any advice for women who experience hair loss because of stress?
Yeah, so I actually have plenty of patients actually come, oh my God, I got hair loss. And I look at her, it's like, why do you think you have hair loss? And then she looked like she's like out of her mind because she got so much stress. I said, you already know that, don't you? And then most of these folks tell me the same thing. Yeah, I'm like super stressed. I want to take care of myself, my mom's sick, or whatever. So then the thing is, most of these folks already know what the issue is. They just need to address the elephant in the room. And the amazing part is this one patient that we just talked about, she came back 2 months later, a month, and then 3 months later, absolutely transformed herself into a much calmer person. In her situation, the thing that makes her stress the most is her daughter, her relationship with her daughter. There's always that competition between her, the love of the daughter with the husband versus her. And she feels like she's always, third wheel, she's not being a part of the equation. It turned out that the daughter is just kind of playing games and manipulating in order to get certain things that she wants. But once they address that issue and not letting that kind of manipulation tactic work on her, then she becomes a lot calmer, and then she can focus on taking care of herself. Miraculously, she does well. Now, there's a second part. Now, what if you don't have any stress? You're doing fine, and then you're still losing hair like crazy, and you take all sorts of vitamin already. The second reason why is your hair follicle is on your scalp, and what goes there is a significant amount of nervous system and circulation. And so the problem is that when you get older, especially, remember the blood vessel spasm, you have less of the blood flow to your scalp, you have less blood flow in general to the scalp, and that becomes a problem. So then two things I think is going to be very helpful. Number one, of course, do all of those kind of supplements we just talk about for hot flashes. But in addition, just the fact that you're combing your hair is important. So instead of combing the regular way right here, comb it from the back to the front. Why? Because the back of your neck is where all the blood vessels coming up. So you want to facilitate that blood flow. So comb from back to the front, and that will help to facilitate extra blood flow to your scalp. And what's the second thing? Shampoo your hair and everything with cold water. Why? Because the cold water is going to be cold, and we are warm-blooded animals. So guess what our body is going to do naturally? Increase the amount of blood flow there in order to keep our scalp warm. And when that happens, you naturally increase the blood flow to your scalp. So shampoo and wash your hair with cold water. Comb your hair from the back to the front. In about 2-3 months, with a healthy diet and reduce your stress, you're actually going to see a significant improvement.
How long after a hysterectomy is it safe to take hormones?
I don't think anyone should take extra hormone. Why do you take hormone in the first place? Your body is never intended to do that. So the question is, well, I had my ovaries removed as well. Then the second question, why you have your ovary removed? So if the main reason why you have a hysterectomy is remove your uterus, then that's the problem. Then remove the uterus, leave the ovaries alone. If you don't have to remove the ovary, then don't remove it. But even if you have that removed, the question is, nothing beats a natural body. So resist the temptation to have all these extra hormone, pharmaceutical grade hormone. There's a study gosh, about 20 years ago called Women's Health Initiative. Actually, the study on a large number of nurses over in Massachusetts area. And what they found is that it actually increased the rates of having cardiovascular problem, increased the rate of having breast cancer, increased the rate of having some mental health issue, like memory issue. The point is, it's just not worth it to buy all these extra problem into your life. So the things to do is have a healthier body, so then get your body acclimate to the less amount of hormones. So even if you have a surgically removed ovary 3 years early, 5 years early, that just means that your body take a little extra time to get to that point. Now, if you decide to have hormone, which is okay, I highly recommend all of my patients, including you, to have a finite time to take the hormone. For example, okay, I really need some help right now. I'm going to do all the stuff that we talked about, but I really need help right now. What do? Well, then do the hormone for 3 months or 6 months. The trick about the hormone is that right now you can find many elderly ladies, probably in their 70s and 80s, and they take hormone for many, many years. And guess what? The minute I tell them, or take off the hormone, they're going to look at me like I'm crazy. They literally already get so much hooked on the hormone, they just cannot get themselves off of it. So how do you get off of this hormone is actually important. So even if you're on it for 3 months, 6 months, a year, the important thing to get off is to wean yourself down. So for example, have a super healthy diet for about 3 to 4 weeks, and then take 1 pill every other day, and then half a pill every other day, and then half a pill every 3 days, and maybe half a pill a week, and then eventually 0 over the course of 6 to 8 weeks or so. Then your body get used to less and less and less the hormone. I think that is the key to success. So don't just kind of go cold turkey, because when you do, chances are you bounce it right back. And that's what happened to a lot of menopausal lady in their 70s that absolutely required to have that. The other thing that people actually make it more popular nowadays, which is kind of sad, is those pellets. You hear about those pellets. Oh my God, I got all these symptoms, need to get some pellet. Well, pellet is just another form of hormone. They actually implant it into your subcutaneous fat in order to secrete this hormone in there. Again, absolutely artificial. Even if they use the natural product, your body is not designed to have all these extra hormones. So therefore, it's really important to kind of, if you use them, find that amount of time and have planned when to get on and have planned when to get off, while you actually fine-tune your body so that you don't become constantly dependent on hormone.
Is there any way to determine how long perimenopause will last?
So the change of life, perimenopause, different ladies are different. Could be 6 months, could be 3 months, could be a year. The question is, does it make any difference? The answer is no, it doesn't make any difference, because the strategy in the treatment plan is still the same. How do you know you're actually going to finish that? Really simple. You look at your period. Of course, assuming that you didn't have any surgery and you have regular period. So of course your periods become once every 2 months, and then every 3 months, and 4 months, eventually every 6 months, eventually nothing. And now if you really wanted to know when your menopause time is happening, really simple, just check this serum test called follicle stimulating hormone. It should be sky high, or at least 25 unit or higher. So when you get to 25 higher, you're there, you at menopause. So that's basically it. But again, the treatment plan doesn't change that much. The only thing changes is that if you have a little spotting, in 52 years old, for example, then is it menopausal bleeding or is it premenopausal bleeding? If it's premenopausal bleeding, they say, okay, well, could be happen naturally as long as the lining uterus is not so thick. But if it's menopausal bleeding, then you want to be the lining uterus to be under 5 millimeter, because when you menopause, you shouldn't have anything going on inside your uterus. So therefore, you want the lining to be under 5 millimeter. So if it's thicker than that, like 10 or 11, then of course it's important to kind of do a follow-up study, biopsy, make sure everything is okay. So that's how you can tell. All right. Well, I guess that concludes the talk on women's health. I'm really surprised you don't ask about endometriosis and adenomyosis, that kind of thing. So to close it up, that is just another form of chronic inflammation. But those of you who are actually diagnosed by that can tell a lot of your friends and family, can be very debilitating. But again, the best approach is to detect and know that early, reduce the amount of stress, reduce the amount of dietary intake that actually put more fuel in the fire so that you can have a better control. It's not about having certain condition, it's about how to manage it so that you can minimize the negative effects of it. The more you know your body, the better it is. At the end of the day, the best doctor in the house is you, and I highly recommend you to continue to follow that so that you can stay healthy and happy, or aka being blissful. Have a good evening. Good night.